Okay. Now, this wall here that we find, what is this, please?
Parietal peritoneum.
The parietal peritoneum, right? Very good. Now, here we encounter the structure. What is this structure here, please?
The diaphragm.
Diaphragm. Very good. Here we encounter a ligament. Which is the name of this ligament, please?
Round ligament of the ligament? No.
Falciform ligament.
ligament.
Yes. Wow, this cat is starting to smell bad. It's true.
Will do.
Yeah.
He's afraid cats use.
Now here we encounter this organ. Which organ is this, please?
The liver.
Now let's go over the lobes of the liver. Which lobe is this, please?
Left lateral lobe.
Very good. This is the
Medial lobe.
very good. And this is the
Right medial.
what is this pouch that I encountered in the right medial?
Gallbladder.
Excellent. Very good. Now, let's continue. This lobe, please.
Right lateral.
Lateral. And then this one?
Caudate.
Caudate. Very good. Now, I encountered this organ. What is the name of this organ? Stomach. Well, let's go over the parts of it. We have this dome area here that is called the
Fundus.
fundus. This is the body. This is the greater curvature. And this is the lesser curvature. Here I encounter another structure. What is this here?
Lesser omentum.
Very good. And it goes from the lesser curvature of the stomach to the
Liver. And it covers the caudate.
There you go. Very good. Now this is another structure that I see is attached to the greater curvature. What is it?
Greater omentum.
Greater omentum. Very good. Now here I see the first part of the small intestine. What is this, please?
The duodenum.
Duodenum. Very good. Now if I flip it,
Does it go the duodenum, then the mesoduodenum? Because it connects to the dorsal body wall.
the duodenum, the way that it stays in place is because it has this mesentery here in the bottom. You see it? And it goes from the duodenum to the dorsal body wall. Very good. Now I'm going to encounter another mesentery. What's the name of this mesentery, please? What does it anchor, please?
It anchors the jejunum to the ileum, to the dorsal body
There
wall.
you go. Very good. Now I continue my journey, and then I encountered this. And what about this pouch? What's this called? Cecum. The cecum. Very good. Now, here in the large intestine, I encounter another mesentery. What's it called, please? Mesocolon. Mesocolon. Now, I encountered this organ. What's the name of this organ?
Spleen.
What type of organ is the spleen, please?
Lymphatic.
And what does it store?
Blood.
Blood. Very good. Now, if you notice that spleen and the stomach are intimately related because they're anchored by a ligament. What's the name of that ligament?
Gastrosplenic.
Gastrosplenic. Very good. Now, we continue our journey and encountered another structure. What structure is this, please?
So round ligament.
Brown ligament, and then this one that goes perpendicular is called the
Broad.
broad. Now here I see this kind of bean-shaped organ. What is this here, please? Ovary. And then this here, this tube is the, what's this tube?
Ovarian.
Not ovarian. Uterine horns, right? Remember that in the cat are going to be longer because they hold the kitties here, right?
Okay.
There you go. So here we see the body of the uterus, right? And the left, it's the right uterine horn, right? And here we see the right ovary, right? Very good. Now, what is this structure that I have here in my hand?
Bladder.
Urinary bladder. There in the urinary bladder, I have ligaments as well. What is this one that I'm pulling a little bit here? It's kind of cut off, but
Medial.
medium what?
Suspensory.
Ligament. Very good.
Of the bladder.
And then this one to the side is the lateral. Very good. Suspensory ligament. Very good. Now, let's continue our journey. What is the name of this organ? Now we're going to go over the blood vessels. Here I see this notch here, right? So what is this, please?
Aorta.
Aorta. Now, the branches of the aorta, the first branch of the aorta is this one. What's the name of it, please?
Brachiocephalic.
And then this is the?
Left.
Carotid.
No,
the left
subclavian.
subclavian.
Very good.
Carotid, not in the
Now, the brachiocephalic gives me branches. I see that this is the trachea. Parallel to, I see this blood vessel. So this must be what?
Right common carotid.
Very good. The right common carotid. And then to the other side, we see the left carotid. Very good. Now, I continue my journey, and I notice that that brachiocephalic is turning to the right. You see this vessel here? So then what is this blood vessel that I have here then?
The right
Subclavian?
Right subclavian. Very good. You cut out the branches of the subclavian. Mm-hmm. All right. Okay. I gave you. Now, here we draw an imaginary line, right? That way we localize the axillary region, right? I know immediately that when that subclavian goes into this line, this imaginary line that I have here, now I call it what? Axillary. Very good. I continue my journey, and then this blood vessel goes into the arm, and it's going to change name like streets, right?
Brachial artery.
Brachial artery. Very good. Now I see another structure here. What is this blood vessel that I'm signaling? What's this blood vessel? I'm waiting. Descending aorta, but it's in where?
Thoracic
cavity. Very good. Immediately, the aorta passes the diaphragm. Now it's going to change name. Abdominal. Very good. So let's go over the branches of that abdominal aorta. So I notice that this is going to be my first branch. Do we see it? This is the celiac trunk, right? Now that celiac trunk gives me branches, right? The first branch we call it the hepatic. Then we follow it, and then it gives me the gastric, and then the splenic. We could literally follow it how it's going towards the spleen. You see it? Very good. Now this is my celiac, right? Then I have another branch. So here is another branch, or the second branch of the abdominal. What's the name of this one, please?
Superior mesenteric.
Superior mesenteric artery. What does it provide blood supply to, please?
Pancreas, small intestine, and colon.
Very good. So the way we verify our theory is by following it, right? And we notice immediately that it's going towards the large intestine. Do we see how it's going to the large intestine? Yes? Very good. The next branch is going to be this very small vessel. Very good. What's it called there?
Is it the renal artery? Adrenolumbar?
Adrenolumbar. You see how small it is? Adrenolumbar artery, adrenolumbar vein, right? Now, I see my other structure here. What's this structure?
Kidney.
I see a blood vessel here, right?
Renal.
Very good. So that's my renal artery and my renal vein. I continue my journey, and I see that there's a blood vessel going here. You see it? So what is this blood vessel doing?
Genital.
The genital artery. Since it's a female, we're going to call it ovarian. Very good.
Specimen for the male, right?
It's spermatic. Yeah.
Oh, spermatic.
Now, the next branch, I continue to follow my abdominal aorta, right? And I see another branch is coming out of it. And it's going toward this structure. So then which branch is this one, please?
Inferior mesenteric.
Very good. Inferior mesenteric artery, right? Because you see how it's going towards the, what's this?
Bladder.
Colon. Very good. Now, I noticed that before that, after that, is going to give me another branch that I see here. What is this branch is here, please?
Iliolumbar.
My left iliolumbar and then my right iliolumbar. Very good. Now, comes to a point that this aorta gives me two branches, right? So which branch is this there?
Left external iliac.
Very good. And then this is my
Right external iliac.
Now I notice it also gives me these smaller ones. What are these called?
Left internal iliac.
Very good. And then towards deep inside there, I see the caudal. You see a very small caliber blood vessel inside the caudal. That one over there. Okay? Very good. Now, I'm going to draw another imaginary line so I could differentiate where the inguinal canal is, or inguinal, right? What we call the name in terms of groin. Now I know that in this this imaginary line from here to here is called iliac. But when it passes when it passes the imaginary line, now we call it what?
Deep femoral.
Femoral, right? The femoral. You see it? Broke the deep femoral.
We didn't do it.
Oh, here it is. Here it is. So here we see that little deep femoral here. You see it? This is the femoral per se. Now the femoral gives me branches, right? This very small one, you see it? I see that it's going on top of the knee. You see it? So which one is this one then?
Superior.
Superior articular. And then this one I notice that goes behind the knee. You have to continue like say. What is this one called?
Saphenous.
No. Behind the knee, please.
Popliteal.
Popliteal. Very good. And then this one continues in the inner thigh, and I call it the saphenous. Very good. All right. When I come back, I expect you to